Welcome again to SpaMedica.com TV. My name is Dr. Stephen Mulholland, and we're going to see a segment, a show today on surgical facial rejuvenation. It's amazing how much this has changed over the past 10 years. There's many things we can do. Subtle maneuvers, shifting, filling, to create youth, beauty, and attractiveness. It's about a natural restoration of youth and beauty and freshness. The 3Ds of growing old: deflation, descent, deterioration. Everybody has different combinations of those. And the show you're going to see addresses aspects, or all aspects, of the 3D aging with 3D restoration. So let's take a look.
Cityline, folks, we are doing an ultimate beauty special today. Today on Cityline, we are doing the biggest facial transformation we have ever done before on Cityline. It's going to be amazing. A couple of the people who are responsible for this, Dr. Stephen Mulholland and Dr. Jordan Saul. Hi, guys. So let's get back to our big transformation on the show today. We were transforming Ella. Ella is her name. Fantastic woman, single mom. She hated her looks. She thought she needed a change. So we're going to give you a look right now of what Ella looked like when she came to us and we started with her. This is Ella then. We're going to take a look at the before and after shot. And throughout the show today, we are going to be showing you the entire process, which I imagine, Dr. Steve Mulholland, was a big one. Talk to me about what you first thought when you met with Ella and what some of the challenges might be with this.
Well, Ella was challenging, almost like a Cinderella, really.
Right.
Because many people present to me and they have some aging changes, but the underpinnings, the foundations of their facial form, their skeleton, are favorable. And Ella just inherited some unfavorable characteristics that didn't allow her to ever project that proportion that she always wanted. So her chin wasn't quite balanced with the cheeks, wasn't quite balanced with the nose. And then as you age without the underpinnings of support, things tend to droop a little early.
Right.
So she had some hereditary issues that bothered her, related to skeletal proportion, and then the usual deflating balloon that sinks and deflates as we age. And so what I set out with her was...
So we have so much to look forward to, is what you're telling me.
You know, it's a challenge sometimes to take someone's vision of themselves and make sure it's realistic.
Right.
One thing about Ella is she was very realistic and a real understanding of what she wanted to achieve.
Yeah.
And so we were able to do that, and it was quite satisfying.
Talk to me about Ella, though. Everybody who has met Ella on this set says she is an absolute sweetheart, just a lovely person, a lovely soul. Tell me a little bit about that.
Yeah, she's an amazing person who's risen above some personal challenges like we all have, but have maintained that really outgoing, alive, effervescent personality. And when I first met her, what she projected, what she showed, really didn't match her internal personality.
Right.
When you saw her external form, she looked sad and deflated and descended, and when you meet her, she's elevated and bubbly, and so she had a classic separation of the personality and the presentation. And in our culture, we just don't like that. We like to look as good as we feel.
Absolutely. All right, well, you guys did a fantastic job. Let's actually meet Ella now as she prepares to change her look, starting at Dr. Mulholland's office. Take a look.
Hey, Ella, Dr. Mulholland's ready to see you now.
I'm so excited. I'm getting a makeover. I've always wanted it. My nose I've hated, and over the years of being a single mom and raising my kids, I just came very tired and worn out looking, and I have the gels to prove the tiredness, and so when I look in the mirror now, I don't like what I see. It makes me very sad, because on the inside, I feel different on the inside, and when I look in the mirror, it just takes away how I feel, and then I get all sad during the day or depressed or whatever.
Ella, good day.
Hi.
How are you?
Excited.
Well, today's our big day.
Yes, it is.
Did you get some sleep last night?
Not at all.
Not much. Well, you're about to get some now.
Okay.
So the nose job, or the rhinoplasty, is going to flatten your bridge, narrow your nose. improve that little bulbous tip. And then the endoscopic brow will lift your brow up. Endoscopic facelift will lift the cheek up. And then the lower neck lift with a smart lipo will give you an improvement in the neck. And then we'll add that fat through this area. And then add some white teeth, and it's going to be a total makeover.
See, and I've told my closest friends, and their reaction was, wow, your prayers have been answered. So they heard me. They did hear me before when I used to talk about it. They didn't think it was some silly thing or a whimsical thing. It was, they knew that it hurt me to look like this, and they were very happy. I can't believe this is happening to me. It just happens to other people. So I feel like Cinderella, and I'm gonna be pretty.
Well, now you've met Ella. She's so lovable. Let's take a look at the process of her transformation on surgery day.
Our first step is we are going to contour Ella's chin, and we're going to remove some of that annoying fat, the waddle that many people complain of, and we're going to use a little laser that melts the fat, liquefies it, and then we remove it gently. Now that we have melted the fat with the laser, the Smart Lipo waddle laser and skin tightening, we're going to take this tiny little cannula and just mop up some of the liquefaction. We have now elevated her skin and reposition that to give her a tighter, smoother jawline.
All right, so you mentioned Smart Lipo. I absolutely have to know what this is. What is that? Is that less invasive?
Yeah, Smart Lipo is, everyone's seen nip tuck, extreme makeover, and it looks like a very traumatic procedure, liposuction. The tendency over the past couple of years has been to a gentler, kinder version of getting rid of the fat. So Smart Lipo is a tiny little laser, about 600 microns, 3 times the size of a hair fiber. You put it under the skin and you melt the fat. So you take the butter, which is your outer thigh or whatever it might be, you put it in the microwave and you melt it, and then you extract it very gently. So it's a 2-stage process done at the same time where you melt and you remove. Less bruising, less pain, less downtime, better skin contraction.
So what would be the difference between all-out lipo?
Well, all-out lipo, generally, the surgeon is using their arm and mechanical trauma to take the fat cells out. It's like taking the butter and chopping it up with a knife. It's quite traumatic, and that's the pain and discomfort that everyone sees. Smart Lipo, laser lipolysis can be done under local anesthesia. You're talking to your physician while it's being done. You can walk out after it's over.
So easier recovery?
Easier recovery, less risk, and better skin characteristics after.
How did things go with Ella? Because you use Smart Lipo on Ella.
I use Smart Lipo to contour under her chin, to remove some of the fat, tighten the skin.
Yes.
And then a little scalp mini lifts here and there to redrape it all.
Now let's talk about people who maybe don't want something even as drastic as Smart Lipo. Are there other things that people can look to do?
Absolutely. I mean, what Ella went through is transformative. It's amazing, but there are risks. There's risks of serious medical illness, of death. I mean, you have to accept this as surgery, and there's risks. We try and do it as safely as possible, but you have to accept those risks. Now, there's many things we can do in aesthetic plastic surgery now that have no risk. We have this thing called the Ultra Shape and the Vela Shape that we use sound waves to melt fat cells like a kidney stone.
Does that actually work?
Of course it works, yes.
Okay,
yes.
Sound waves.
Yeah, sound waves. So ultrasound, infrared energy can melt fat. We've got tremendous skin tightening techniques. We've got Botox, we've got fillers. You could look 5 years younger in about 30 minutes with non-invasive treatments.
Right. Yeah. Well, when do you know you need to go sort of beyond Botox?
Beyond Botox, that's good. That would be a good show.
Yeah,
beyond Botox. when you look in the mirror and you just go, oh my goodness, who is that?
Yeah.
And you're beyond maybe a 3, 4, or 5 year transformative freshness, and you want to take the risk of surgery. You want to turn back the clock on time and appearance, and you're willing to undergo that risk, then you're a good surgical candidate if your expectations are realistic.
Well, we talked a little bit about this before, during the break, and I wonder how many people go in and think, I just want to change myself, I want to change my face. You probably have to have a pretty strict set of criteria in terms of who you accept and who you don't, because some people aren't really dealing with, I want to fix my face, they're dealing with other issues.
Yeah, so it's your other issues, you're exactly right, secondary gain. So a good plastic surgeon, I've been doing this 15 years, years, you get used to, I'm not going to be able to save your marriage. I can't bring your husband back.
You can't?
I can't.
Dr. Mulholland.
I can't. But I can find you a new one.
Okay, well, that's good. That's good.
And I can't get you the pay raise. I can't save your job. I can just help how you feel about yourself. Then you and your healthy mind have to go and change your life.
Okay.
Yeah.
I want to go back to Smart Lipo just for a moment then. You said that people can leave. You can literally leave right after it's been done.
It's a walking ambulatory oral sedation local anesthetic technique.
Well, then why wouldn't everyone just do Smart Lipo rather than lipo?
They should.
Okay.
Yes.
So can you do my abs after the show?
Well, that would be brilliant lipo.
They're missing. I don't know where they went. Okay, very good. Talk to me a little bit more about Ella in particular. Did you have any problems at all with Ella's? Was it all smooth sailing? Did everything go as you wanted it to go?
Ella was. It was a long procedure. It was 8 hours. I was changing the skeletal structure of her face and the soft tissue over it, so it would fall into the big group of procedures you might do rather than medium, but everything went very, very smoothly. She was a healthy person, non-smoker. I do a lot of screening tests to make sure people are healthy.
Does that make a big difference if you're a smoker or not?
Oh, absolutely. If you smoke, there's many things that I probably wouldn't do because smokers just don't heal as well, like diabetics and other issues. So to have a big surgery, you can't be a big smoker.
Okay. And now you said you changed skeletal.
Yeah, so I reduced her nose, I brought her chin forward, I brought her cheeks up.
Right.
And that was at the bony level, and then I rearranged the soft tissue on top of the new bony structure.
How long did it take for her to recover?
Well, it was about 3 weeks till she was looking acceptable. So when you do major surgery, transformative surgery, you need some downtime in recovery. You can't, you read about these weekend facelifts.
Yeah.
Unless the surgeon takes a weekend to do it, there's very few people that look good in 2 days, unless it's really under delivered. So most people think you need about a week off for minor stuff, need about 3 weeks off for major stuff to be realistic. Now,
Ella seems to be absolutely elated with everything that happened. It was just a really good experience for her. Do you ever have people that come out and think, oh no, why did I do this?
I think there's a normal wheel of reaction to any transformation, and we're aware of that, and we help people through the changes. So I would say yes and no. No to those individuals that want a little subtle lift, a little they look the same, just a little fresher. When you take someone who's had a genetic challenge, never had the nose or the face they wanted, and you actually give it to them, there's a psychological shock there. And you need to select the right healthy candidate. And some people are astounded and amazed, and some people are going, oh my goodness, and they're worried that they're going to look so different that people make comments.
Right. Yeah. All right. Dr. Mulholland, thanks so much for that.
Thank you very much, Tracy.
We've got a goodie, as I promised during the break. Everyone will receive a sample of 3 products from the SpaMedica Skin to Skin Treatment System. It's a gentle skin cleanser, a pure vitamin C serum, a facial sunscreen that is specially formulated for use under makeup. That's for all of you guys in the audience today. You'll go home with that.
It's been to be honest, a roller coaster ride. I was so excited, and yeah, everybody's nervous about surgery, but the end result is, it's what can I say? I'm loving it.
When I first saw Ella, she presented because she was really unhappy with the overall projection of her face. She's one of those classic patients who feels young, acts young, but looks older than her stated age. And so she wanted to look more youthful. And she was in her late 40s, looked like she's in her early 50s, and wanted to be in her late 30s. She was born with some hereditary challenges, nose that was too big, chin that was too weak, a brow that was high and was droopy, and a lot of her soft tissue was just deflated and descended. If you have a beautiful face, everything looks wonderful, and you have the $1 million look and the 5-cent smile, you need teeth. And so a wonderful job on her teeth has really brought all the picture together.
When you have a smile, the whole rest just takes over. It's just amazing. I can't even put it into words. It really, really lightens up your face, the way you think, the way you talk. Before I would talk into my hand, I would talk like this, and now it's like, I'm talking. I just got more self-esteem. Yeah, a lot more self-esteem. And it's going to get better. I just know it.
You've got to be dying to meet her. The Ella we've been talking about throughout the entire show. Everyone, Ella. Give her a big round of applause. Come on up, Ella. You look fantastic.
Thank you.
How do you feel?
Like Cinderella?
Yeah.
Yeah.
You're looking a little like Cinderella.
Well, thank you.
Talk to me about this whole journey.
Oh, this journey's been amazing. My feet has not touched the ground. I'm loving this. I don't walk with my head down anymore. I'm smiling and saying hi to people on the street.
To strangers?
Yeah, strangers.
Hi, I'm Ella.
Getting
Look at me, I'm pretty.
Getting phone numbers pushed in my hand and getting on
You're
the bus
kidding
for free.
me. Get out of town. Are the men all over you?
Oh, yeah.
Well, that is thanks to your two doctors. Thank you, Dr. Mulholland and Dr. Saul. You're getting her dates. Good work. Very good. Listen, we chatted a little bit before the show, and almost only 2 words came out of your mouth, and you were in tears. This is why people love you, though. You're so happy about this change, and I think that's what people like to see. They like to see somebody who they didn't feel like their insides were being reflected on the outsides, and that's why they went for cosmetic surgery. Is that how you felt?
I remember walking into the office and he said, "What did you want to accomplish?" I go, "For my inside to be like on the outside."
Yeah.
Yeah.
And do you feel that way now?
I do, and more so.
Can I talk to your babies because they're here as well?
You sure
Your
can.
2 kids?
You
All right,
sure
let me
can.
talk to them. What's your name, sweetie?
Randall.
Randall, how old are you?
I'm 15.
Okay, so you're the son. Tell me what you thought when your mom said, "I'm going to go in, I'm going to get this done."
Really? I was disappointed.
Oh, really?
And then after, to hear her that she said it'll make her happy, made me feel good. So I had to, I don't know.
That's all you needed to hear, eh? It'll
Yeah.
make mom happy and you're happy with
Yeah.
it. How about you? What's your name?
Alicia,
Alicia, how old are you?
14.
Okay, how did you feel? How do you feel about the makeover?
Excited?
Are you excited for her?
Yeah.
Is she hot?
Well, I can't judge her.
I can't call my mom hot. She's absolutely gorgeous. So you're happy for her, though, huh?
Yeah.
Okay, fantastic. So tell me how this has changed your life. Are there things that you're going to be doing differently now? I know you're smiling down the street, you're getting digits from all the guys, and you feel confident about yourself. Are there other changes that are going to come out of this?
The changes that I'm going to try to make. Before I would take something lower level, but now
Yeah.
I'm going to reach for the stars. Yeah, for sure.
And is there anyone that is sort of skeptical about this big change? Is anyone acting a little weird around you now that you're this new fabulous self?
Actually, no.
Good.
No, not at all.
Fantastic.
Yeah.
I'm so excited for you. You're so lovable. Thank you so much, Ella. Stay with us as well. We're going to have the results of our live makeover in the audience, and we're going to talk to Ella a little more after the break. Stay with us. All throughout the show, we've been talking about Ella. We've seen the process of her transformation. Let's just give you a final look at her because it was such an amazing transformation. Take a look at Ella before and Ella now. Look at that. You know, what's interesting about all this is that we've sort of encapsulated this very big transformation. People are seeing it within the hour of the show. And, you know, people don't necessarily get a sense of how big this is, how much time this takes, how much thought goes into it, the recovery. So talk to me a little bit about what people need to think about before they go and do something like this.
Well, from my perspective as the plastic surgeon, it's a big psychological transformation.
Right.
There's a physical recovery. There's a financial commitment. You're basically taking one of the biggest commitments you'll make in your life to your physical self, and you need to set that time aside. It needs to be the right time in your life, and you need to be emotionally and psychologically committed.
What are we talking about recovery-wise? How much time?
If you break the face into thirds, let's say brow, eyes, cheek, and lower neck, each third takes about a week to 10 days. So if you do all thirds, you renovate the whole house, right down to the foundations, it's a good a month to 6 weeks till you're looking right. And so it's a lot of hiding out period, a lot of recovery period, and it can be amazing, but people have to be prepared for that. There's no weekend surgery recovery for the face, really.
Dr. Mulholland, fantastic job, all on Ella. Thank you so much to Ella, and stay tuned tomorrow. City Line is home day. Good job, guys.
Wow. I hope you enjoyed that example of some of the many things that we can offer here at SpaMedica for facial rejuvenation surgical procedures. So come in and join me in www.spamedica.com. Check out under the problem list of what you're looking for, or under the procedure list of what you think you want. Feel free to come and see me for a consultation. I look forward to seeing you and helping you achieve the kind of youth, the kind of freshness, the type of attractive beauty that you're looking for. Thank you very much.